So I've been practicing pharmacy for the last 13 years in America. And I've been opportune to work in the retail and ambulatory settings. Earlier in my career in the United States, I volunteered in the hospital. So I have a little bit of understanding of what pharmacy is and the hospital. But I've spent most of my years working with community and ambulatory patients. I do what I do because I'm very passionate about people. I love to help people. I love to connect with people. So, I'm a high achiever. My to-do list every day always gets busy. So probably over time burnt out. So 2019, I got burnt out. I got real sick with autoimmune disorder. I'm a mother of 3. So, you know, my kids are quite young. So trying to balance parenting and working a full-time job. In fact, at the time I had 2 jobs, a full-time job and a part-time job. So I guess my body in 2019 was like, I can't take any more of this overdrive. So I started looking for how to rebrand myself in the healthcare industry. And luckily for me, we are in a season where the world is going digital. So I thought of, there must be a digital way to do what I enjoy doing, what I'm passionate about. And so that was what led to me founding my first company in digital healthcare, RESTUR. So currently, I am repositioning myself as an expert in health and wellness. And our mission is to help healthcare workers like myself to achieve a healthy work-life balance. Because I have been a patient, I have been a pharmacist, I have been a healthcare worker, I have been a mom. In fact, with the 3 kids, all 3 births were high risk pregnancies. So now I get to work with colleagues who are just starting the journey of parenting, and they're having to juggle. I'm getting a report, I'm having high risk pregnancy, I'm struggling with trying to keep this job. They're so sad. So I come as one who has overcome the challenge, and today positioning myself to encourage, to empower, and to educate healthcare workers on how to manage both work and life and still achieve that abundant life. I want to encourage people to know that it's not either or for us. We can have an abundant life if we know how to manage and balance our daily chores, our personal and professional life.
Thank you for your introduction. That is so awesome. I also suffered from burnout with the birth of my first child when I was at the top of my career, and I couldn't take time off. And I had also had a complicated high-risk pregnancy, very similar. I'm a single parent of 3 little kids. I have to manage several jobs, so I know exactly what it's like. And I mean, burnout can get so bad that I ended up in a wheelchair, lost everything, my job, my income, my health. And I could easily have died. I was like this close. So that's why I'm so passionate about helping other people. And ideally, I want to stop people a bit earlier, that they don't get that far down the hole. Because when I had burnout, which is a long time ago, nobody knew about it. So I saw like 10 different doctors, and they all thought something different, and nobody gave me the right diagnosis or treatment. So yeah, that's why I'm very similar to you. I'm also passionate about that. So I asked you to prepare 3 golden nuggets for the people who are listening that people can implement straight away. Something they can do to either avoid burnout or balance their life better. What are your 3 golden nuggets that you can share with the listeners today?
That's very, very powerful way to start a new year. Today is the 2nd day of a new year. And so this is the best time that we could have come together as a team to encourage our healthcare workers any professional, anybody that is dealing with these issues that we've just mentioned that we dealt with, especially parents of multiple kids, 3 things that I had to implement. I mean, like I had to implement it in order for me to survive and bring in that balance. 1 was self-care. I learned how to prioritize myself because growing up as a first child of 6 children, I never knew how to take care of myself. I didn't have an elder sibling to show me way. I had to show the way for 5 siblings behind me. There was the standard was set so high for me that I didn't know how to receive. I just knew how to pour out. So recently in my health and wellness journey, I have learned to prioritize self-care. And part of prioritizing self-care is that I have let go perfectionism, trying to be a perfectionist. I have understood what it means to enjoy the moment. So I show up every morning, not caring too much about tomorrow, focusing on what my to-do is for today. So I do have a plan every morning, and I make sure that from my long to-do list, I highlight my top 3 most important goals. And out of the 3, 1 of it has to be for me, for myself, which is my exercise, my diet plan, and my meditation. Because as a person, I have to take care of my physical being, my soul being, and my spirit being. So I start my day connecting with my spiritual needs, which is with a meditation in the area of my faith. Then I make sure that before I start taking care of my kids or my husband or any other person, I eat. My body needs to eat. And then I love to write. So I either get on any of my social media pages and share a blog to encourage other people, because I have come through a lot. I have learned through my pain, and I positioned myself to be an encourager to others. So I might journal. I have a journal where I might write what, as I meditate, I get to have that better mental clarity to express myself in form of writing. So that is how I start my day, with a plan, with the top 3 priority lists. 1, me, 2, God, and 3, other people. And that way I get to balance my need to give and my need to receive.
Absolutely. I love it how you express that, especially the 1, 2, 3 in the end. The other topics we have discussed before on this show about self-care, medication, proper nutrition. But I love that you say I can first take care of myself, then God, and then others. That is exactly how your soul will feel balanced. That is beautiful. I love that.
Yeah.
All right. Well, thank you so much for sharing these golden nuggets with us. And how can people reach you, and how can they work with you? Can you tell us a little bit about that?
Okay. So what I do, I'm a health and wellness coach, and everything about what we do is about a restoration recipe. I tell people my personality is not to cry over spilled milk. I don't like to worry, oh, I made a mistake, oh, I've wasted my years. It doesn't matter how old you are. There's still time to improve. So that is the reason why we had RESTUR RX founded. RESTUR RX just means restoration recipe. So we give you a recipe to start afresh. If you want to reach us, RESTURRx.com is our website. I can be reached on Facebook as Josephine Anyanwu. I can be reached on LinkedIn as Josephine Anyanwu. So if you want to reach Josephine, just remember, I'm looking for a restoration recipe. I want to find RESTURRx.com. We are also on Instagram.
There's an awesome name. Make sure that you share it correctly with me so I can put it with the video, which I'm going to put on YouTube. And I'll share a copy of the video with you. And if people want to work with me, I've got a new website, burnout-doc.com. So I'm trying to want to start a challenge, a 7-day challenge coming up. So anybody who's interested, please contact me. It's completely for free, because I am so motivated in helping as many people as possible. I just want to jump out there. I know there's so many people with burnout in the healthcare profession, especially now with hospitals filling up again, with all these COVID patients. And from my own experience, I feel that not often have I received the necessary care. Being burnt out as a healthcare professional, I had to go and look for my solutions myself. So I'm here, and I'm on a mission to save 1 million lives from burnout.
My God.
So glad to meet you.
That's so great.
Yes, and I'm sure we can come together, when we do a burnout summit or something. I'll put you on the list, and then we can do that together. That would be so awesome.
That's great, Pearl, because I always tell people at work, teamwork makes the dream work. So the more of us out there to help other people, especially with the COVID and the crisis and the global pandemic, I think that's a great mission you have out there. And I am very open to join your team and empower healthcare workers to remain and retain that balance in their wellness.
I love it that we met, and thank you so much for your time. And I'll let you go now, because I'm sure you have lots of things to do, but it was wonderful meeting you.
Thank you so much.